Our group's topic was poverty. So we focused on how poverty affects health professions, specifically nursing, emergency medical services, and dentistry. We would like to acknowledge that we are gathered on the traditional, ancestral, and unceded territory of the original lands of Anishinaabe, Ininiwak, Anishinaniwak, Dakota Oyate, Dene, and Inuit, and on the national homeland of the Red River Métis. We as a group recognize and respect the spirit and intent of treaties and treaty making and remain committed to working in partnership with First Nations, Inuit, and Métis people in the spirit of truth, reconciliation, and collaboration. We acknowledge the harms and mistakes of both the past and the present.
To start off our presentation, I would like to talk about what poverty actually means. Poverty refers to lacking basic resources people need to live, things like food, clean water, and clothing. But today, the definition goes beyond just physical necessities. Poverty can also mean having limited access to essential services such as healthcare, education, and even transportation, all of which are important for a person's overall well-being. Poverty is a complex and long-lasting social determinant of health, shaped by systematic factors that can affect families for generations. Its impact can begin even before someone is born and continue throughout their entire life, influencing their health and health outcomes in significant ways. And these impacts are something all healthcare professionals need to be aware of, whether they're doctors, dentists, nurses, pharmacists, EMS responders, or occupational therapists, because poverty shapes many of the challenges patients face in their everyday life.
The first profession we are going to look at more closely is nursing. For anyone who isn't aware, nurses work to promote health, prevent disease, and help patients with illnesses. Nursing is fundamentally based around delivering direct patient care and acting as an advocate and educator for patients, families, and communities. The first article I'm going to focus on is a peer-reviewed scholarly article which was sourced from the Online Journal of Issues in Nursing and is titled Deconstructing the Concept of Poverty for Nursing Education. This article is focused around the concept of poverty and more specifically how nurses are being educated on how to correctly deal with an individual who is or has been affected by poverty. The purpose of this article is to emphasize the importance for nurses to develop the skills needed to assess and intervene in situations where individuals are impacted by social detriments of health, specifically poverty. Some main findings throughout this article were that nursing students from all sorts of various socioeconomic and cultural backgrounds find it challenging to comprehend the structural, political, and societal factors that influence health outcomes. This article goes on to highlight how the implementation of experiential learning opportunities within nursing education can and will allow students to engage in the process of cultural humility by being able to recognize implicit biases, stigmas, and stereotypes that may influence their care delivery. Lastly, this article found that educational strategies such as poverty simulations served as a tool to help promote empathy, cultural competence, and awareness of the multifaceted nature of poverty. These simulations are hands-on, immersive experiences with the goal to improve attitudes toward poverty and increasing awareness about external causes of poverty. Some key takeaways from the findings in this article would be the emphasis for nurses to obtain the education and skill development needed to be able to identify needs and connect patients with necessary resources. This article's findings also highlight how experiential learning and collaborative activities help nurses to gain confidence to contribute to the development of interventions, policies that promote social justice and health equity. The second article I'm going to focus on is a peer-reviewed scholarly article which was sourced from the Open Nursing Journal and is titled The Role of Public Health Agencies in Addressing Child and Family Poverty Public Health Nurses' Perspectives. This article not only highlights the continued rise in poverty rates among families, but also the impact that it has on public health nurses. The article goes on to emphasize the lack of perspective from nurses on their roles in addressing poverty within literature. In this study, a qualitative descriptive research design used to highlight the opinions and impacts that the nurses who address child and family poverty have. Furthermore, emphasizing the importance of taking into consideration the nurse's perspective regarding the impact of poverty. The study was conducted with the goal to obtain answers to specific questions from nurses themselves. After being granted approval, purposive sampling was used to recruit participants themselves. 23 female nurses participated in one of 75 to 90-minute focus group interviews. Prior to the interviews, participants filled out a demographic questionnaire, and afterwards, content analysis was used to group the responses to each question into thematic categories. One of the main findings included throughout this qualitative descriptive study was that public health nurses are being assigned to do tasks that fall outside of their typical role, thus taking time away from their primary responsibility, which is to promote health and prevent illness in individuals, families, and communities, with particular attention to the needs of vulnerable populations. Another finding was that public health nurses collectively agree that their ability to communicate with the regional health authorities is non-existent, and that even though nurses feel the responsibilities and see the hardships of their role firsthand, they lack the authority to use their opinion and experiences to shape their role in response to the community's needs. Lastly, the study found that nurses have agreed that the Regional Health Authorities organization is based purely on business aspects rather than discussing or implementing nursing roles around the issue of child and family poverty. Some significant findings were that there was a significant gap between nurses' theoretical role in addressing poverty and their actual role. Furthermore, the findings highlight the organizational barriers to addressing poverty and how nurses' participation and effectiveness in promoting population health is enabled or constrained by organizational values, policies, support, standards, and funding. Lastly, the overall findings suggest that even though nurses have the ability to have a more distinct role in addressing child and family poverty, it is extremely unlikely to occur without the organization that they work within making changes to support them.
Emergency medical services, also known as EMS. What are the roles and responsibilities of an EMS provider? They respond to medical emergencies, so they travel to scenes of accidents, sudden illnesses, or natural disasters and provide immediate care. They assess patients, so they evaluate the patient's condition to determine the necessary treatment. They provide emergency care, so they deliver a range of medical treatments from basic first aid to advanced life support, depending on the patient's needs. They administer medications, so they give medications including IVs and injections to treat their conditions and manage their pain. They perform life-saving procedures like CPR and intubation. Transport patients, so they secure and transport patients in emergency vehicles such as ambulances while continuing to monitor their condition. Communicate with hospitals, so they relay patient status and information to the receiving medical professionals that are getting this patient. They maintain their equipment, so they ensure all medical supplies and equipment are clean, stocked, and in good working order before and after their call. So the first article that I had picked was How Do Social Needs and Risks Affect the Professionals Working in the EMS Health Profession? So the purpose of this article was to measure prevalence. So they estimate how common various social risks like housing, food insecurities, and domestic violence are among EMS providers. It compares different subgroups. So they look at differences by gender, role, and employment status and burnout, and inform policies. So they suggest that understanding these social needs should help make policymakers design interventions to reduce burnout and improve the EMS profession. This article type was a peer review summary. The key findings that were found in this article were that 23% said they experienced housing insecurities, 27% had food insecurities, 31% struggled with healthcare affordability, and 41% reported mental health concerns. Burnout was highly tied to social risks in this profession, and women were more affected than men were. Overall, the key takeaways from this article were that high levels of social insecurities were up, mental health and burnout was extremely high, coping skills like substance abuse were tied to this profession, and systematic and workforce implications were suggested so that they could make policies on how to improve this profession. The second article that I had done my research on was social factors and frequent callers. The purpose of this article was that it was to understand how different social factors affect people's quality of life and why are they calling EMS services more frequent than other people. So the article was a peer review as well. The key findings in this article were that they had high levels of loneliness and social isolation. So between 37 and 49% of people called EMS reporting that they were lonely. Poverty and food insecurities. So 14.9% of people said that either they or their family had gone hungry in the past month. 43.3% reported financial difficulty. They didn't have enough money to make ends meet by the end of the month. So poor quality of life. 74.6% of participants had at least some issue walking. For self-care, 55% had difficulty washing or dressing themselves. And 67% had moderate or extreme anxiety or depression. Overall implications for health services said that the low quality of life and high social risk may indicate that chronic illness is common among frequent EMS callers. It suggests that poor access to EMS services or primary care might drive some of these people to call EMS more often. The key takeaways to this article are that there's high levels of loneliness to people who have isolation and not as much income into their family, and that if they had better access to care, that they probably would have a better quality of life overall.
The last profession we'll be discussing in this presentation is dentistry. Before I talk about how poverty impacts oral health, I would like to give a brief overview of what dentists do. Dentists evaluate a person's overall oral health and provides guidance on preventing disease before they start. They perform a range of clinical procedures, identify, diagnose, and treat various oral conditions. Some dentists practice general dentistry, while others specialize in areas such as orthodontics, periodontics, or oral surgery. In addition to patient care, dentists also contribute to dental research, helping to improve treatment methods and promote evidence-based practice in oral health. Next, I would like to share findings from research article called Impact of Poverty Reduction on Oral Health Outcomes Among U.S. Adults. This one was published in the Journal of Dental Research. This was a cross-sectional study that looked at how reducing poverty levels could improve common oral health conditions, including periodontitis, which is gum disease, tooth decay, and dental pain. The study included data from over 13,000 adults aged 30 to 70 who completed dental examinations between 2011 and 2018. The researcher assessed both absolute and relative poverty. Absolute poverty refers to household with income below the minimum threshold required for basic survival, while related poverty is defined as having income below 40 to 60% of the population's median income. This study showed that poverty makes it even harder for people to get the things they need, which can lead individuals and households to poor oral health and limit access to essential dental care. The researchers also used hypothetical scenarios to estimate how reductions in poverty, 10%, 25%, and 50% would affect oral health outcomes. The biggest improvements were seen with a 50% reduction in related poverty, which result in a 12% decrease in periodontitis, a 13% decrease in dental caries, and an 18% decrease in frequent dental pain. These findings show that oral health problems affect more than just teeth. They can disrupt sleep, concentration, diet, and daily activities, and can even cause severe dental pain, anxiety, depression, and missed work. Importantly, this research suggests that addressing poverty isn't only a normal responsibility. Isn't a moral responsibility. It can actually improve people's oral health and overall health. Reducing poverty brings multiple health benefits, not just improvements in dental outcomes. These insights are especially important for policymakers and health advocates working to tackle poverty and related health issues. They also fit with broader public health goal of considering health in all policies. The second article I'd like to discuss is called Access to Dental Care for Low-Income Adults: Perceptions of Affordability, Availability, and Acceptability. This one was published in the Journal of Community Health. This case study looked at how low-income community access dental care from the perspective of patients, dentists, and other healthcare providers. For these studies, the researchers conducted 60 interviews with low-income adults who either had sought or felt they needed dental care in the past 2 years. They also reached out to 50 dentists by letter from a list of 36 dental offices, and 6 of those dentists agreed to be interviewed. The study found that the cost of dental care and limitations or inaccessibility of public insurance programs are the major barriers for many people. It is often difficult for patients to find dental clinics that accept government coverage, and the treatments covered by public dental benefits are usually limited. In addition to financial barriers, the study highlighted social challenges. Some patients reported feeling unwelcome or uncomfortable at dental offices. On the other hand, dentists expressed frustration over missed appointments and the financial and operational difficulties of providing care for low-income patients. Ultimately, improving access to dental care means that we have to look at the root of the problem, the poverty itself. Many people living on low incomes are put in a position where they have to choose between basic necessity like food, housing, and dental care. And the financial barriers don't come out of nowhere. Public dental benefits often do not provide enough coverage for the people who need them most. On top of that, the reimbursement rates for dental services are usually quite low, which makes it even harder for vulnerable communities to get proper care. Overall, this research article shows that even when dental services are available, low-income adults can face multiple barriers, both financial and social, when they're trying to get care. Understanding these barriers is important for healthcare professionals, including dentists, to help improve access and ensure that everyone can receive the oral health care they need.
So some common findings between our three health professions are poverty negatively impacting health outcomes. So all three professions demonstrated that individuals living in poverty experience worse physical and mental health, higher levels of chronic illness, dental disease, and unmet health needs, more frequent use of emergency services as well. Barriers to accessing healthcare was a big one between all three of them. So financial barriers, so inability to afford care, medications, dental treatment, limited to resources, so transportation, food insecurity, lack of insurance, and reduced availability of services for low-income communities. Another one was increased stress on health professionals. So healthcare providers working with low-income populations experienced emotional strain, burnout, and overwhelming caseloads. They also experienced role confusion, especially in nursing, and challenges communicating with institutions or advocacies with systematic changes. Social factors are a strong determinant of health. All articles highlighted that loneliness, isolation, and social instability worsened health outcomes. Poverty is strongly tied to mental health concerns, and broader social circumstances directly shape patients' well-being. The need for system-level changes was a big one. Current systems do not fully address the need of those living in poverty. More support, training, and policy reform are required. Poverty must be understood and a systematic issue, not an individual failure. So overall, across nursing, EMS, and dentistry, the common theme is that poverty has profound negative effects on health access, health outcomes, and the experience of both patients and healthcare providers. Health professionals need more training, resources, and system-level support to effectively care for population affected by poverty.
When it comes to poverty, different healthcare professions notice and focus on different things. Nursing, EMS, and dentistry each look at it from their own perspective, based on their specific roles, responsibility, and challenges. In nursing, the focus is on education and raising awareness about poverty among nurses, so they can better understand and support patients experiencing social and economic challenges. EMS emphasizes the close link between poverty, social isolation, and unmet needs. People living in poverty often rely more heavily on emergency services because they may not have access to regular health care. Dentistry, on the other hand, focuses primarily on financial barriers and limited access to dental care, which can prevent people from receiving the treatments they need. Overall, while each profession looks at poverty from a different angle, together they provide a comprehensive view of how poverty impacts health and healthcare delivery.
Significant findings. Nursing. There's a significant gap between nurses' theoretical role in addressing poverty and their actual role, further highlighting how nurses' participation and effectiveness is prompting population health is enabled or constrained by organizational values, policies, support, standards, and funding. EMS. Poverty significantly affects both EMS providers and patients. EMS professionals themselves experience notable levels of poverty and social factors, Additionally, individuals who frequently rely on EMS services often face severe social challenges, loneliness, and limit to basic resources. Together, these findings emphasize how deeply poverty affects the EMS profession, from the well-being of its providers to the complex needs of the patients they support. Dentistry. Poverty limits access to dental care, increasing risk of tooth decay, periodontitis, and dental pain. Low-income adults often face barriers such as high cost, limited availability of dental clinics, and gaps in public coverage. Reducing poverty is not only a social responsibility, but also an effective way to improve oral health and overall well-being.
Ending off this presentation, we wanted to emphasize how important it is as health professionals to understand that poverty is not a reflection of an individual's decision, but rather an indication of the systemic issues that limit one's ability to meet their basic needs, such as accessing food, housing, or healthcare. As healthcare professionals, it is our job to not only help individuals navigate the healthcare and social welfare system by connecting patients with resources, but also our responsibility to act as advocates for our patients and use our voices to speak out against outdated policies with hope for a broader change that can reduce health inequities for everyone. Thank you for listening.